Hi, everyone. Good morning, good afternoon, and good evening. This is Patricia from the International Hospital Federation. Thank you so much for joining us today, and I hope you're all safe and well. It's my pleasure to introduce the facilitator of this exciting session, Sylvia Basaraca, Membership and Project Officer of the IHF. Hi, Sylvia.
Hello, Patricia. Thank you very much. Hello, everyone, and welcome. Thank you for being so many to join. This is very nice, and it demonstrates that to get the perspectives of a younger generation of healthcare leaders is of interest worldwide. So to briefly introduce myself, I am Sylvia Bassarecea. I joined the International Hospital Federation about 2 years ago, and my background is global health. Therefore, I learned and experienced the importance of an interdisciplinary and international dialogue when it comes to health issues. And this is exactly what we wanted to emphasize with this Young Executive Leaders Program, to offer a platform for people from different backgrounds and settings to discuss, share, and learn about issues that they are facing, sometimes on a daily basis, and for which they seek the perspectives from peers around the world. This morning, actually, our Yale group had an exclusive masterclass with Sam Allen, CEO of the Sussex Partnership NHS Foundation Trust in the UK, and she talked to them about diversity and inclusion. She reminded us something very simple but very true. She said that not anyone represents everything, and we need diversity to represent all points of view and embrace differences, which is very relevant for our program. Another goal of this program, and perhaps the primary goal, was to give the possibility to young professionals to build an international network and sustainable friendships. I'm very glad to say that I believe that we have reached all of our goals this year. Before presenting the 2020 Yale Adventure, let me just ask you a question. So Patricia, if you can please launch the poll. So the question is, what sentence or sentences have you heard the most this year? Please pick 2 maximum. You're on mute, adapting to the new normal. Sorry, I need to jump on another call. Sorry, that's my dog in the background. Hopefully we'll see each other face to face in 2021. So we'll give you a minute to reply.
All right, everyone, you can now see the poll question and the options. Just select it. We'll give you 5 more seconds to click in your answer, and then we'll share the results. So I'm closing the poll in 3, 2, 1. And here are the results, Sylvia.
Thank you. So the winner is, hopefully we'll see each other face to face in 2021. So yeah, we all hope this. And you're on mute, come second. I think many of us heard that, and we may actually even hear it today. So thank you, Patricia. You can stop sharing the results. This question was to show that this has definitely been a very special year in which a lot of the interactions, especially international ones, were done virtually. And this was the case for a 2020 cohort of young executive leaders. So after a call of applications, the group was created in April. And in the first 2 months of the program, they got together to share and brainstorm about daily professional challenges. The purpose was to break the ice and start building relationships. In July, they split into 2 working groups, one on digital leadership and the other one on leadership challenges in times of COVID and beyond. The groups were supervised by the steering committee, so it's 2 to 3 members of each group, from which you will hear later on. And each group has published 4 articles, which are available on the IHF blog, and which they will summarize today in their presentations. For a long time, the Yale group and myself thought that we would have the chance to meet face-to-face in November for the IHF Hospital Congress in Barcelona. However, as you can expect, this did not happen, and this is why we're all here today virtually. Therefore, we are glad to see that the successful outcomes of this program and they, arrived despite the fact that we have never met face-to-face, but only communicated virtually like many people this year. We do sincerely hope that we'll see each other in face-to-face in 2021, at least on the occasion of the IHF Hospital Congress, which will take place in Barcelona in November 2021, and which you're all welcome to attend. So without further ado, I will let today's speakers come on screen to briefly introduce themselves, and I will hand over to them. So we have Siegfried, Safia, and Vanessa. So if you would just like to say a few words about yourselves before we start, perhaps Siegfried, you can start.
Hi everyone, I'm Ming-Ju Tsai. You can call me Siegfried. I'm from Kaohsiung Medical University Hospital in Taiwan. I'm a pulmonologist and intensive care doctor, and I also the secretary of the superintendent office. So I help our superintendent running the hospital. It's a great pleasure to join IHF and share our experience with each other and make connection. And I'm very glad to see you all. Thank you.
Thank you, Siegfried. So Siegfried will be presenting the first group's outcomes, and we have also Safia and Vanessa for group 2.
Hi everyone, my name is Dr. Safia Alhammadi. I am from Dubai, UAE. I'm currently an obstetrician working in Latifa Hospital in Dubai. I'm also the chief resident in Latifa Hospitals. I work mainly with pregnant patients who are also COVID patients, and we also work during the pandemic. We worked also with the general population of COVID and part of the frontline team. I can't wait to share with you guys our articles in general of the second group.
Hello everyone, my name is Vanessa Braga. I'm a senior staff nurse who works in Coimbra in Portugal. My main role is nursing care and shift management in a pediatric ward. And I was very pleased to join the 2020 Young Leaders, Executive Leaders this year. And I have been more focused in the thematic of leadership issues in times of COVID-19. I hope that you enjoyed the virtual forum today.
Thank you all. So now I think we can hand over to Siegfried, who will present the outcomes of the first group. Siegfried, the floor is yours.
Hello, everyone. I'm Ming-Ju Tsai. So it's a great pleasure to share our group's discussion with each other. So our group focuses on digital health. So we have actually several discussions and we have published 4 articles. So we will go through what we have done in this year. Our group has 7 people come from several countries, including Spain, UAE, Germany, UK, US, and Portugal and Taiwan as well. We actually did a survey to help us identify which kind of the question we have encountered in the recent era about the digital health problem. And this quantitative and qualitative survey from IHF members to help provide more data about how digital health are impacting healthcare across the globe.
Sorry, Siegfried, I'm sorry if I can just interrupt you. Can you perhaps have the slides in a full mode? Okay, now it's perfect. Yeah, perfect. Go ahead, sorry.
Yeah. So the result of the survey gave a broad overview regarding different topics in the field of context digital tools. And this result offers concrete as well as practical answers for integrating digital tools into healthcare system. That we have identified there is some regulatory barrier, including compensation and licensing. We also have highlighted the issue about ease of access and usability of records are very important nowadays. And we found that many people concerned about the inequity to patients' access. They highlight that the patient should own their own data and have quick access to their medical records. And most of our members also highlight the security issue are very, very important. So it comes to our first article, introduce our national and organization perspective on digital initiatives. The Portugal health system consists of 3 coexisting systems. There's a national health service, and there's also special social health insurance system and voluntary private health insurance as well. The digital transition is a priority for Portugal government, mainly in public sector, with the focus on citizens' literacy, open data, interoperability, and digital tools that allows the access to all the clinical records across the whole health ecosystem. and they has successfully developed and driven during the COVID-19 pandemic. And some telehealth initiative and implementation of IT system sounds very, very interesting and successful. As for the UK, they has a healthcare system is well known for its National Health Service, the NHS, and founded in 1948, which includes hospital, physician, and mental health care founded primarily through general taxes. And later in 2019, the NHSX launched the new program to drive digital transformation and lead policy and implementation. And the US system is a mix of public, private, and for-profit, non-profit, insurer, and providers. For over decades, there has been a focus on digital transformation of healthcare. Therefore, there has been a tremendous interest and progress in the UK and US in enabling digital tools in healthcare. The healthcare system of Germany is organized as a multi-payer healthcare system paid by a combination of public and private health insurance. The hospital founding in Germany is based on a dual financial model. Digital health solutions offered as mobile apps are in high demand due to the growing number of smartphone and tablet users across all generations. In the psychiatry and psychosomatic field, digital solution can be a valid supplement. So here comes the digital care law regulates the rights of every patient for digital tools. The use and value of telehealth tools, such as video consulting, have grown during the COVID-19 pandemic in Germany. The Catalan healthcare system provides public financed universal health coverage that is free at the point of access, thus ensuring that everyone who lives in Catalonia has the right to healthcare. This system, which dispenses services for 7.6 million inhabitants, gives a major role to community and primary healthcare and the use of information technology and digital health. Catalonia is a pioneer in the use of information and communication technology in public healthcare and is considered a forerunner of e-health adoption in Europe and is currently implementing a comprehensive digital strategy. So that the integration of the health information system between primary care and specialized care allow for fluid telemedicine-based case management. As for the healthcare system in Taiwan, we have a national health insurance, which is a single payer program with mandatory enrollment and low co-pays operated by the government. Since instituted in 1995, the coverage rate has increased rapidly, reaching 99% of the whole population of more than 23 million. It covers all necessary medical services. Information technology has been implemented in the management. Each patient is issued an NHI card with which they can access the medical system. Information of healthcare resource utility, such as diagnosis, medication, and procedures, is uploaded to a centralized data bank for information sharing and for administrative purposes. Because of the high healthcare accessibility in Taiwan, people may seek medical care in several facilities. So to enhance patient safety, the NHI administration set up the patient-centered NHI MediCloud or PharmaCloud system, which through which medical professionals can access the patient's medical records in this system. As COVID-19 became epidemic, the Minister of Interior National Immigration Agency provided immigration information, and the agency uploaded the information to the system as well. So the medical institution were able to check the travel history via the system as a quarantine measure, and some institutes even developed their own quarantine system with the batch downloading function. A personalized cloud-based service called My Health Bank System was launched in 2014, released part of patient medical records to the beneficiaries, so people can conveniently access their own latest medical information and insurance status. This may empower people to more directly control their health and narrow the information gap between doctors and patients. As COVID-19 became epidemic, the government controlled the selling of face masks. So people were able to order masks via the name-based mass distribution system, which was closely related to this system. In addition, telemedicine is available for people in home isolation and home quarantine. The UAE has a comprehensive government-funded health service and a rapidly developing private health sector that delivers a high standard of healthcare to the population. Healthcare is regulated at both the federal and emirate level. Public healthcare services are administered by different regulatory authorities in UAE. The 2021 vision of the UAE commits the government to ensure universal access to healthcare services by all Emiratis. The UAE government is committed to provide world health class healthcare services. In Dubai, the healthcare is experiencing rapid innovation through modernizing of patient service delivery and infrastructure projects. The Dubai Health Authority serves a dual role as regulatory operator of the Emirates of Dubai's healthcare sector. Priorities for the healthcare sector in Dubai include retain and attracting high caliber medical and healthcare staff, strengthening initiative around postgraduate healthcare education, continuing investment in primary and specialized health services. And in 2016, the Salama program, the Dubai Health Authority's electronic medical record, was inaugurated. Salama is a DHA-wide project that aims to provide patients and doctors access to medical records through a patient portal and to ensure that the electronic medical record is available across the DHA health facilities. According to our national perspectives and professional experiences, it appears that digital and leadership challenges we all face are very similar and have only accelerated and become more important during the COVID-19 pandemic. The main challenges for digital leaders include making users' experience easier and more equitable for all, improving professionals' adoption, improving patients' literacy, improving cybersecurity, data security, and data protection, as well as improving interoperability of the systems. Our second article focusing whether COVID-19 is enough for the successful improvement of patient and citizens' engagement to e-health. The COVID-19 pandemic has added tremendous demands in healthcare and other business sectors. It also facilitated the implementation of e-health by using digital solutions such as m-health apps and wearables. Citizens can actively engage. Benefits of digital health include increased social distancing, reduced potential infectious exposure, reduced cancellations and missed appointments, and reduce the need for personal protective equipment. However, there are still some limitations, including no physical assessment, reduced confidentiality and trust relationship, social exclusion, as well as low patient adoption and acceptance of digital health tools. According to Hartman and Lin, the key elements for improvement enables the identification of common building blocks of success, including these few aspects, such as applying leadership, vision, and value, making stakeholder and ensuring supporting policies, and so on. With this in mind, some possible recommendations will be include digital solutions must have a relevant impact on their users, and all the main stakeholders should be involved in the process of scaling up. Citizens should be able to see who access their health data and why. And there also need to create incentive for managers and staff. The assessment of visual expenditure and budget of scaling up process are also very important. And also developing monitoring tools and define key performance indicators must be taken. And there must be emphasis on interoperability between the various platforms. Taking Portugal, for example, the existence of a shared service of the Minister of Health from Portugal, who developed several national applications for citizens and healthcare professionals. And these applications are now widely used. The main question remains how to improve the digital solution for citizen healthcare providers' interaction and their engagement. While we focus on this perspective, the topic is about leadership, incentives, and accountability. An excellent example of this is the sharp increase in virtual visits during peak outbreaks of COVID-19. This shows that large-scale implementation of this tool is possible with the right incentive and urgency. Although the benefits of use of such digital solutions are known, we continue to face a number of barriers and challenges, such as lack of interoperability, different information platforms, as well as healthcare professionals' adoption of these technologies. So in addition to the highlights of the benefits and challenges to patients' engagement, we also discuss about the benefits and challenges that healthcare professionals' adoption of this technology. We came out with several recommendations for engaging healthcare professionals, including the investment of the infrastructure, open electronic database, increased interoperability, effective governance processes, and the leadership. To break some paradigm of our healthcare professionals, we need to focus on these actions, such as management based on measurable indicator, constant feedback to our teams, monitoring our projects on the field, auscultation of internal, external customer, defining the strategy by top management, local commission of clinical information, massive training of the professionals, and provides all the necessary tools, and as well as simply clinical and administrative processes, ensure indicators, and as well as explore the health scan of these tools. For the experience at Cleveland Clinic and Cleveland Clinic London, three important practices that ensure healthcare professionals successfully adopt digital health tools are these three: the executive investment, the technology ecosystem, and as well as clinician leadership. Engaging staff using the Lean Agile leadership has been successfully implemented in some hospitals in Portugal as well. The COVID-19 pandemic has accelerated this entire digital transition and rethink the way we relate to work and people. But probably there was still no time enough to agile strategy. So the sense of urgency has had a catalytic effect. For example, our hospital in Kaohsiung developed the information technology to facilitate patient care in the isolation ward rapidly. We also rapidly set up an active surveillance system for identifying suspect COVID-19 cases in the inpatients. So critical successful factor to facilitate healthcare professionals' adoption with digital health tool include strong collaborative work among the various services of a hospital, involvement of the frontline professionals, importance of observing, discussing, and acting on the ground using technology and artificial intelligence. And agile development is as well very important. We still have several problems to be solved, but we do see some possible changes by COVID-19, including the drive and encouragement of the smart health and great culture, the technology, and taking the health as a strategic priority at a global level is very important in pushing us forward. Finally, we have also discussed about the importance of legal framework to catalyze digital transformation of healthcare. As medicine is a highly specialized field with high risk and uncertainty, the legal regulations about healthcare are usually stricter than those in other fields. The digital health solution, which did not fit in older legal framework, require legalization. In our recent published article, we have several examples that demonstrate the importance of legal framework to improve telehealth. So, in conclusion, virtual visits and the use of other digital health tools were picked up rapidly under COVID-19, which indicates that this can be done. And the slow growth in the past was perhaps a reflection on founding politics or other things. Our survey showed that there were many barriers, but COVID-19 actually showed how we can manage despite these barriers. During our discussion, we learned that we can all think more boldly around these tools and not just adding more application or software, but actually changing the mindset and the workflow to support patients and healthcare professionals with the tools we now have available. We need more digital health leaders. Some countries in our group appear leading in the field of digital health, and we take that advantage to learn from each other through the platform set by IHF. Finally, development of and engagement with these tools require collaboration with the end user and agile work styles. And this comes to the end of our presentation, and thank you for your attention. If you are interested in our discussion or the focus which mentioned above, you can scan the QR code, which will guide you to the article we have published. Thank you very much.
Thank you very much, Siegfried, for this interesting presentation. We will also share the link to the blog articles in the chat for everyone to have access to these. So through presentation, you managed very well to locate your topic within your respective health systems and show how from there you identify the priorities to focus on and suggest recommendations which would be applicable for all patients and healthcare workers. We already have a very interesting question for your group later on, but we'll wait for the discussion part. So thank you again, Siegfried. We'll see you after for the discussion. And while Vanessa and Safia come on screen, please let me just remind to everyone that if you have a question, feel free to hit the Q&A button and to just type your question in there, and we'll try to respond to your question during the discussion time. So Vanessa and Safia, the screen is yours, and have a nice presentation.
So, as I said before, myself, Vanessa, Braga, and Safia are part of a group of 9 elements, which through this program dedicate our discussion to leadership issues in time of COVID-19. Hospitals around the world since February had and still have a tough mission fight against COVID-19 virus. From one side, these hospitals had to create strategies to care patients with COVID-19, as well as trying to prevent the dissemination of this virus. Point that our experience reflects different impacts of COVID-19 in our countries and hospitals, as also takes into account our different roles in the organizations. In the past month, we discussed and highlighted some challenges and best practice taken in Spain, Austria, Kenya, Portugal, Dubai, Germany, and how to handle this pandemic from a leadership perspective. The result was shared by publishing 4 articles, as you can see, that we will speak about them briefly through this presentation. So in the first article that were called Management of Leadership during an era of COVID-19 pandemic, all of us faced the same basic difficulties, and we experienced the common core strategies. First, switch from a conventional mode of leadership and management to a crisis mode with other command structures, creating by a COVID task force, and also appropriating communication and information management. Secondly, cohorting patients, organizing new areas, new teams, and new patient flows. For example, putting professionals in cohort in different hospitals areas, changing the work shift patterns to reduce the cross-infection risk between the professionals, also setting up triage tents outside of emergency department buildings, and also redesignate wards to help during this crisis. Last but not least, the pandemic posed several threats to the medical employers, so the staff protection couldn't be forgotten. So, defining policies to enter in the hospital and to reorganize infection prevention and control protocols were one of the main cores. Also assuring personal protective equipments and also psychological social support. Then, looking for from an inspiring perspective during COVID-19, and despite all the massive workloads and all the difficulties, difficult conditions at work, we saw and we could notice a great solidarity of all the employees. Also was very inspiring that the technology, as we heard before, became an important tool as the telework, as the telemedicine, which has increasingly significantly became an important key and will be in the future for certain. No less important, the research still ongoing and many kind of projects around all our countries. We, from our point of view, still be some areas that need further thinking and strengthening is the hospital finances and also the response to COVID-19 patients. So in the second article, if something that we didn't have any doubt is the direct relation between engagement and efficiency with team motivation. So this article included various steps taken regarding the organization and structure to keep the hospital function and different organizational strategies to encourage the commitment, satisfaction, and engagement of health professionals in a period as complex as COVID-19 pandemic. So the keys that we found to be factors to support and keep up the motivation and engagement from our perspective should include ensuring professionals' well-being and taking a deeper, closer look into this topic, changing the varied shifts to ensure continuity and sectorization of groups. Also, active listening by leaders. Supplies needed to be managed carefully and need to be enough to make the employers feel secure. Facilitate the teleworking always as possible. Create clear protocols for the many requires. Also perform screenings of professionals on a regular basis, keeping the contact and telephone monitoring of professionals when they were in quarantine or on a sick leave, and also be able to give and to provide psychological support to their staff. Then, other key factor is education and training. The focus still the same, protecting professionals. So creating a working group of experts to collect the data. The leader must filter the information and make sure it reaches the team as it should be, because during this time, there was a lot of information and it was very changing. and ensuring that the staff had the proper training, for example, for the place of EPE, protective equipment, or other kind of equipment during this virus. Then other main topic is communication. Is a core element for a good leadership. It must be clear, accessible, and a consistent information top down and also bottom up. Leaders have to deliver meaningful and transparent information on the current situation and the steps that they will take in the future, and involve always the team with them. As leaders, we couldn't forget personal guidance and encouragement. Healthcare workers at the front line need to have their leaders to be with them, to be present in the units and to collaborate, to know their situation and to listen and answer their needs and worries. Also, leadership should be based on organizational support, as proven to be a successful strategies on the different hospitals to encourage motivation, productivity, and engagement of healthcare workers, meaning that the employers believe the organization cares of their well-being, consider their goals and values, help them when they have a problem, and trust that they will be treated appropriately. Then will be Safia speaking about the next articles.
Thank you, Vanessa. I'll take over now from my colleague, and I will be speaking about our next third and the fourth article for the second group. So in our third and the fourth article in the second group, we have came to conclusions regarding the leadership perspective of managing COVID during the pandemic time. So I'm pretty sure everybody remembers where they were in March 11, 2020. On March 11, 2020, the WHO has confirmed our biggest fear, that the COVID has officially become a pandemic. And we all remember the conferences that came out when they spoke about it, that it's officially now a pandemic. It took a pause for us because we heard about the pandemic, we've studied about the pandemic, but now we are living a pandemic. It also gives all those leaders a challenging point in their life as the leaders of the healthcare systems. So let's go together and find out what was the challenges that the health leaders, they faced it and how did they tackle it. First was the target. Any health leaders and institutes at the time of the March when the pandemic has started, they all has decided to put a target in their mind. The first target was, of course, reducing the contagion and reducing the contact and isolating the COVID patients. By this isolation, of course, we all heard about the lockdown that happens and all the isolation for all so many patients that happens, but also brought one of the biggest fear, which is hospital bed shortage. So the second phase of their target was to increase the number of hospital beds, and mainly for those critical patients, because during March and April, the cases of the critical cases were going increasingly high. So it gives them another target to focus on, which is planned activities and appointments for the patients who are considered chronic, but not acute or asymptomatic patients. For those, majority of those cases, their activities has been either postponed or changed in order to provide for us a good hospital beds or an ultimate places to have the patient to be isolated for us to focus on the patients who are in a high-risk group of COVID-19. And also the creating of a new organized area in any institutes, especially the hospitals. The organized area we are speaking about, which is area that can welcomes the patient who are COVID patients. They are taken from the ambulance, their own access area, taken to the isolation room. So those new organized area was also the focus of many hospitals. This way they can reduce the contagion or the infection between other patients. Those areas were made to identify COVID-19 patient, non-COVID-19 patient, and general outpatients area. And then comes the challenges. Of course, any health leaders has faced the challenges during the pandemic. And we all remember the challenge of the PPE, which rose sharply and dramatically among all hospitals around the world, because it was a pandemic, something new, not understood, not known how to protect from it. The consumption of PPE was increasingly high. And we also saw how some of the staff nurses had to work with a simple surgical mask with the COVID-19 patients. Some of the doctors had to make a new kind of paper or plastic dresses, as we can see in the picture. This poor nurse is wearing a garbage bag. So the consumption of the PPE was one of the main challenges among all the health leaders. The other thing was the employees' adherence to infection control measures. Of course, you will not have an employee adherence to the control measures if you are having a PPE shortage. How will they adhere to the infection control measures if the staff is not having the correct PPE to wear it? Majority of the staff, even around the world, they were having the same PPE reused multiple times. So the adherence to the infection control measures was out of the window, like we said. The third challenge was, of course, the ventilator supplies. And this was one of the strongest and most heartbreaking challenge. The ventilator supplies has demand increased dramatically, which led some of the doctors to be in a very tough decision of choosing which patient to be on ventilator and which should not. And this decision should not be made by doctors. All the doctors should have enough supply of ventilators. But of course, with the pandemic, we cannot say that. The supply of the ventilators increased so much, the companies could not provide it, and it was one of the third and most hard challenge for the health leaders and the physicians themselves. So now, what did the impact of this pandemic have it on the patients and themselves? First, hospital bed become closed down for non-emergency cases, which made the patient who are for the routine follow-up, for regular follow-up, chronic patients, pregnant patients, have no access to the hospitals. The second impact, the hospital yet accepted all the chronic and the symptomatic cases to the hospitals with welcoming hand, because we all know symptomatics and chronic or high risk should be still accepted to the hospital. And the COVID swabs. We all know the shortage of the COVID swabs and how it was limited to multiple patients. But then the effect on the patient was that one of them is that the majority of hospital has made or make a temporary area, which is an access area for any patient who's coming for elective admission, patients who are coming in as an acute emergencies, to have their swab taken before going in the hospital. This way we are ensuring that the infection control is almost controlled in a very good way. The third one was the visiting for the inpatient were mostly suspended in majority of the hospital around the world, protecting the patient themselves, but also it had put a role on the patient mental health. The third one was the telemedicine. Telemedicine, I will speak about it more later on, but it was one of the good impacts, positive impacts of the pandemic on the patient, where their chronic care was not ignored. The healthcare, all health leaders, they were all able to reach out for their patient at the correct time and the correct manner and still continue their care. The fourth thing, forming a new patterns or new forms or make a shift. This way that this new flow or new guidelines in each hospital, it impacts the patient in a positive way in making a new process or flow for a patient to enter from the emergency room, meeting this such a nurse and then going to this such a doctors. This new flow and the guidelines that has been implemented, it was for the patient's sake. Now, what the impact did it have on the healthcare professionals? The first and the furthermost impact was fatigue. A lot of healthcare professionals have faced fatigue, burnout, and even depression because of the pandemic. And how was that? It was because of the long working hour shifts, no leaves, continuous working days with no breaks. This has put a toll on all the healthcare providers, whether it's a doctor, a nurse, or a simple messenger worker. They all have reached the fatigue because from the pandemic, from March till now, we are still facing this matter. And of course, we have to keep in mind the fatigue have reached all levels of providers in the hospitals or any healthcare institutes because of this integration of care, where we have to see that the other system, they have primary healthcare, other nurses, even administrative, they have to come and share with us the care of any patient. This way, it made a new flow. It helped the doctor, but it also put the risk of other providers to be in the risk of fatigue, although some of them were not even a clinician, but they all have contributed and worked together during the pandemic to help all the healthcare providers. The fourth point was that, which is a good point, majority of the hospitals have provided for all their staff the ability to go home and work remotely, this way to reduce the stress on the family about having them transmit the diseases to them. And if the work can be done remotely, they were all granted around the world. The third one, providing of the PPE, which is one of the positive impacts that it affected the staff and it raised the happiness among them. Providing the PPE all to your staff, you are adequately making sure that your staff is protected and a good mental health. Fourth point that contribute all of them, which is the mental health of your staff. Majority of the healthcare workers and the physicians have been under the put of the stress of not knowing what to do, scared of the new disease, long working hours, increasing number of deaths, fear of transmitting this to their families. So the mental health has taken a toll also on all the staff, but all the health leaders or the great health leaders have taken on their right to take care of the mental health. And now I will be telling you how the strategies have implemented to take care of the staff well-being. First, there was no contract termination during the crisis. Nobody was laid off their work, nobody was fired. No short-time work in any department. PCR mass testing for all staff. I'm pretty sure everybody has experienced the PCR testing for them. Maximum protection granted for the staff by providing them all sorts of PPEs. Employees supermarket where they can reach out and buy whatever they are feeling like. A COVID hotline for all the employees. This was implemented in majority of the hospital where the employee can reach out and have the help he wants regarding his mental health. And additional kindergarten places was also provided for those who were not having any place where they put their kids to overlook them, and free disinfection for employee family. This way you ensure you're happy, your staff are happy as a leader. And now for our last and fourth point, which is the success story that was learned and the lesson learned from the management of this pandemic. The success stories usually, for the success stories, we have summarized it to 7 points. And I will be speaking about those 7 points more in my next slides. The first point was sectorization, which means separating the suspected and potential COVID cases. It's one of the most successful things that happened. By sectorization, all that your COVID and non-COVID patient, you are reducing the risk, making a new infection protocol that for your staff to follow, and the continuous training for those protocol, you adhere that those people are separated and nobody's infecting each other. Telecare, one of the most important points among all the words is that telecare. It was an easy thing, just a matter of having a phone or a laptop with a computer in it. You have your physician with you at home. He can reach you anywhere, anytime, and give you any kind of advice without putting yourself or your family at any risk. Even if you are immune compromised, non-immune compromised, you don't have to put yourself at the risk if it's nothing urgent. And it protected the staff or the doctors by not having to use the PPE every time they see a patient, by decreasing the number of the outpatient accesses. The third point, we have the flexibility of care, which is one of the important points, was that redesigning the work process in a way, making it flow easier. That is because we are in a pandemic, to make it flow easier, an easy way to access the medication, easy way to access some sort of swabs, or easy way to access some sort of guidelines. High flexibility in care, it increased the number or the success rate of controlling the disease. Provision of safe and quality. This one was the most important point also, because as we talked before, the PPE supply, again, PPE supply, PPE supply. The PPE supply providing for your staff is going to ensure that your staff is going to come to work every day and giving you their best of their effort, because they know that when they will go to work and they will leave, they will be fully protected. The other thing about safety and quality was that special care for children and elderly. In majority of the hospitals around the world, children and elderly, which is vulnerable group, the children are very scared to come to the hospital with all this PPE wearing staffs. So what happens is that some of the hospitals have given the program of home care, of which they go to your home, they take care of your child, or they diagnose your child, they do the necessary testing, and even for the elderly. The third one is the clinical trials, and we all are hearing about all these clinical trials going around the world for our own safety, for us to find a good vaccination. This was also an important point, the facilitation of the clinical trials. Integration of care, different hospitals around the world and many levels, many levels, they collaborated, like the primary healthcare, the hospitals, they all collaborated in the monitoring and the treatment of the non-symptomatic patient at the extra hospital environment. For example, some of the places, they have makeshift field hospitals in like a stadium, and makeshift field hospitals in a wedding receptions area, or even they made in hotel rooms. So this integration of care, of making other places can take care of the non-symptomatic patient, it reduced the risk on on the hospitals, reduce the load on the hospitals, and it gave a great way for the patients to be treated in a very good or manner way. And treatment of the sickly and elderly and dependent inpatient was also part of the integration of care, where so many physicians in so many different specialties have helped each other. So many nurses, some pediatric nurses have helped in taking care of COVID elderly patients, because part of tackling this disease was integration of the care of all over the healthcare system. Leadership. The most important point also is the breakdown of the unnecessary bureaucracy or bottlenecks in the organization. This breakdown of this glass wall between anybody and their leader, it helped greatly the team that the spirit become maintained for them to continue working on a daily basis. Health leaders also have had worked even more closely with the political leaders, and it aided the hospitals and the governmental places. It aided them to have a financial support also to see what the pandemic is actually doing. Last, and for me, the most important point is continuum of care. I've said most important point for everything because everything is important, but the continuum of care is very important. Why am I saying this? For you to be a great leader, you should continue the care that you are doing, start the correct care, continue the care that you are doing, because you never know when you will have your second, third, fourth wave for this pandemic. And most importantly, the continuum of care that the most challenging for any leader is for you to go back to the norm of life and still maintain the protection of your staff, your patients, and still reduces the infection rate among the other population. And here I'm going to show you one last graph to show you that the graph is representing the COVID cases around the world. I've brought some examples of some of our members where they've been working with us: Kenya, Germany, and Portuguese. The red line indicates the waves of death. The blue line indicate the wave of cases. As we can see in the first wave, both death and cases was increased. But at the time we went to the second wave, the death is slightly reducing, but again increasing. So now, this is what's important, the continuum of care. Are we going to overcome this disease by continuing the good leadership position, or are we not? Thank you, everybody.
Thank you so much, Vanessa and Safia. It was so insightful. Thank you also to Siegfried, who can also come back on screen, by the way. And thank you to the whole Yale group who helped contributing to these very interesting outcomes. I think that both your presentations were very complementary and important for today and future health leaders and workers. It shows that more and more we see that professionals, including those with managerial positions, must master an increasing set of competency, which run from technical business skills to compassion and care for the staff, their patients, their communities. And likewise, we see that digital transformations are not something futuristic anymore. They are part of our present, and we must see these as an opportunity. So also, as we have seen through this presentation, it's not only health professionals and patients that have to adapt, but also the regulators and the legislators. So of course, also the specific context in which we currently are with COVID-19 informed your articles and the outcomes that you have presented, which is probably very valuable for the audience, which, by the way, is 127 people with us today. So I hope that everyone enjoyed these presentations. Before we move to the discussion and the Q&A, I still have one question for the audience. So Patricia, if you can launch the second poll. So the question is, after hearing these two presentations, what are your thoughts regarding an international dialogue between a younger generation of healthcare leaders? First option is, I want to know more and I will read the group's articles. The second is no different than any other group work on health issues. It's possible. Exchanges between local contexts, health systems, cultures are an added value for relevant decision making as per think global, act local. Or barriers created by local contexts, health systems, cultures are too important to make these dialogues relevant. So I will let Patricia manage the poll and we will wait for your reply.
All right, and here are the results, Sylvia.
Okay, thank you, Patricia. So, well, thank you, very positive. I'm not going to lie, it was what I was expecting. So we have 56% of the participants who think that these exchanges and dialogues are relevant and that they have probably to be nurtured, and also some interest to read the group's articles. So again, I will share the links later on in the chat. Of course, it is likely that in some contexts, you have to focus on local settings and so on, so it can remain, not as relevant, but the majority is that these things should be nurtured, which is very good. For the speakers, Vanessa, Safia, Siegfried, do you have any comments on the results?
I'm glad to see that people enjoyed and are happy, and we will want to read our further articles.
Great, thank you. So Patricia, I think you can stop sharing the poll. Right now, I have the pleasure to welcome all the group of the 2020 Young Executive Leader Program on screen for this last part of our webinar, which will be around a discussion and questions. So again, don't hesitate to ask questions in the Q&A. So you can just click on the Q&A button and type in your question. I'm sure you're very curious about what our young executive leaders have to say. And to lead the discussion and respond to your question, we will have the steering committee of this year's group helping out. So I have the pleasure to introduce these members. So we have Sama Al-Muntaza from Dubai, Renee Bogues from the US, but working in London in UK, and we have Siegfried, who you know already, for Group 1, and we have Christina Ulrich from Berlin, Germany, and Florian Trumer from Vienna, Austria, who is a representative for Group 2. So I will let everyone come on screen. Perfect, so you can have good faces on the people that have worked so well on these outcomes. And before we move to discussion, I'm actually going to launch it with a first question for the steering committee. So through your presentation, we have seen that you have managed to reach a consensus and an agreement on several topics, despite differences in your background, in your settings, countries, and so on. So would you like to tell us a little bit more about the challenges that you have faced because of these differences and the fact that you're a heterogeneous group, and how you overcame these challenges? And perhaps you also want to just reflect on the answers of the poll that we just had.
So thank you very much. So I can start. As every time in our group, I always want to start to speak. Yeah, the Young Executive Group was a very interesting group this year, and we had a lot of challenges as well. One of the big was that I'm here because we are from everywhere in the world, and when in Austria is the evening, somewhere in the world it's the morning, and so it's very difficult to stand everybody in the same meeting. So, but we did it several times, and we have every 14 days we have a short Zoom meeting then, and we did 4 articles as well in the last 8 weeks or 9 weeks, and everybody of the Young Executive Group did a wonderful job there, and yeah, I'm very out of it, so I'm very happy. And yeah, thank you very much.
Great, so more opportunities and barriers. Renee, you wanted to come in?
Sure, yeah, I'll just add on to Florian's points. In our group, we had quite a distance in terms of time zones with Siegfried in Taiwan. I was in the States for some of our group's meetings. And so between the two of us and everyone in the middle in Europe, we had some challenges finding the right times. But I think, like Florian kind of highlighted, we just remain flexible and agile to work together. And so I think that's a key theme across all of the work that we've done as a group of 17 and in our smaller 2 groups. It's just being flexible with one another to recognize the work that we have outside of IHF and then also the work that we do together. I think the second kind of bit of takeaway for me is how much we've all learned from one another and have come together to really create these bonds and these friendships. I've really enjoyed kind of our WhatsApp group in an informal setting over the last few months, supporting one another as we've gone along in our personal and our professional lives. So I think that is going to remain. And I personally am quite grateful for that opportunity these last few months. And in some ways, I think with COVID, we've been able to form those bonds even stronger than we may have had done so in the past. So thank you. I'm looking forward to meeting everyone, hopefully in 2021, back to Sylvia's original question to kick off the call.
Thank you. Anyone else wants to come in about barriers, opportunities? Otherwise, we have one question for the audience. I encourage also everyone to ask their questions. So it is for group 1 mainly, but everyone is welcome to take part in this answer. So the question is, how can we design digital health tools on the basis of patients' expectations? Since you have identified that there is sometimes a lack of patients' acceptance and resistance to use these tools, this can be a barrier. So how can we actually learn from these expectations to create some more efficient digital health tools?
I can maybe start, and then anyone from our digital group, if you want to add on to my feedback or comments. A few things that we touched on in our second article, which was about this topic, was I'll highlight 2, and Rita or Jonas or others in our group that I haven't highlighted, please jump in. The 2 that come to mind for me are the generational differences and understanding what the literacy is for our patients. And so I think both of those go back to the idea that we have to understand from our patients what they need and what would be most helpful to them. I think all of us in the provider side may have great ideas about what we think would be helpful, but we actually kind of don't know until we speak with those patients. So I think getting to know from patients exactly what's most helpful and understanding their literacy, both from an individual's perspective and from a generation perspective, is helpful, and one thing we talked quite a bit about in our group. Rita, Jonas, Laura, anything else that I missed?
Penny, thank you. Yes, this must be a co-creation process, always a co-creation. This world is very important for us, co-creation, even more nowadays.
Thank you. Anything to add from group 1 or the other? Okay, so let me ask another question. So this comes from Helmut Kahn. So the young executive leaders came to an agreement in many different areas. Politics in their respective countries had a very different response to COVID, though, which is very true. So how did you manage to reach a consensus in your own conclusions despite these differences in the political responses, and on which response you think makes life easier for healthcare executives or more difficult? So when you talk about lockdowns, no lockdown, data protection, and so on. Okay, Christina, go ahead.
Thank you. Excellent question. I would like to recommend what we did was a continuous dialogue about everything related to COVID until a certain point when we even didn't want to talk about it anymore. But since a pandemic cannot be ended by a single person or a single hospital or even a single government. This dialogue was very, very helpful for each one of us, as well as, I guess, for all of our organizations, because we've been talking a lot about measures and actions taken in our organizations and how they worked and maybe why they didn't work. And as Vanessa and Safia and Siegfried showed and presented the results, we found consensus on measures that have been proven to be really, really helpful. Even though some of us didn't use them or didn't even know them before. But this is what I guess the YEL program is about, having a dialogue and a great learning. And this is actually what happened here. So thank you very much.
Thank you, Christina. Does anyone want to comment on this question, which is actually a general one on when you have a different setting for something, a different perspective, just also based on the organizational culture. How was it to did you also have in your group discussion some debates because you didn't agree on something, or and how did you manage to get the consensus on okay, so this happens for me and I think this is the right solution, but for someone else it will be totally different. So how did you manage to work through that? And we have some other questions as well, so we can perhaps jump on this one afterwards. So okay, so from Melinda, who was a young executive leader last year, would anyone be willing to share one learning from the experience they have or will be taking back to their organization?
Here I can say something about this. One of the big findings for me as a leader in this situation was speed beats perfection, because you have to make decisions very, very fast. Yeah? And for me, this is one of the big findings also for the future.
Thank you, Florian. Perhaps someone else wants to also just let the audience know what is the key message that we'll bring back to your organization after this.
Also, I would add that, as I said as well, the amount of information that is available about COVID sometimes is a bit insane. And as leaders, I found that in my organization it was very helpful have protocols defined with clear informations to be accessible and to help them have evidence-based information that can be easily accessed and no other documents. And I think that was a very important point that we, from our discussions, we moved for in my organization.
Thank you, Vanessa. Anyone else? So we can move to the next questions. So it is actually one question that comes from several people if we reformulate it. So what do you think the competencies for future leaders are, especially beyond this COVID crisis? We have learned a lot and we see that things have changed and that we have to handle things differently. So if you think of management skills or competencies and the way the situation is evolving worldwide in healthcare facilities, what would you say are key competencies or leadership quality that you would need to have to face the situations in the coming months and years. So if perhaps we go to someone, yeah, Siegfried, go ahead.
So I think the most important two skills to overcome this situation, the first of all is the communication skill. So through our networking, we did have good communication with each other and learn from each other. I think the communication skill is very important in managing the hospital, to lead the hospital or lead the healthcare system overcome this crisis. And the second most important one is the implementation of the novel technology. With these kinds of novel technology, we have better chance to overcome the crisis. We have more power, more weapon to overcome this. So that's my perspective. Thank you.
Yes, I think the same. And you need to be near of this or the staff, near the staff, because the staff need all information in the clearly information, and need send near your manager and the organization, explain the objective all time. Is very important for the team, I think.
Thank you, Ma.
Hi.
Anna, you want to come in?
I would like to say that for me, promoting real teamwork is the base, because we have so much pressure in our daily work. Doctors are working a lot, nurses are working a lot, technicians are working a lot, and we don't have time to be with each other, to work really together. And this pandemic make us understand that we really need each other. We have to be more flexible. We have to work not only in our institution, but also with other institutions in pre-hospital care and post-hospital care. Otherwise, we won't be able to help our patients in a good way. And also, we are going to get tired, and we can be really with our mental health really low. So I think really important is teamwork, promoting teamwork, and leaders need to do it.
Thank you, Anna. Does anyone else would like to come in? Yeah, Christina, go ahead.
Yeah, thanks. I would like to add 2 points. As Florian said, you need to be like very decisive and make quick decisions. But another important point for me is to have an approach of empathy or even of, I don't know, love or whatever, care for your employees. As Mafalda said, healthcare workers are very tired, and this pandemic puts a lot of pressure on them. So as a leader, you have to take care for them very, very much. Even, of course, also in times without a pandemic, whenever that will be, hopefully soon, but always like watch out for your people.
Thank you, Christina. So I think these were very relevant comments that you all gave, and that reflect also what you have said in your presentation, you know, importance of communication, of teamwork, of good planning, which is critical. As time moves on, perhaps does anyone want to give a final comment, perhaps those from the steering committee? So if Siegfried, you would like to say something again, Renee, Florian, or anyone else about this experience, what you take away, and also what excites you about, you know, this is actually one of the questions that was also ask, what experience, what excites you the most about your future as an executive leader, since you're at still an early stage of your career and will have still some time in front of you. So these will be the concluding remarks. So if a couple of you have anything to say about that, please, the floor is yours. So if Renee, yeah, go ahead.
Yeah, sure. For me, I think this was a terrific opportunity to meet with different leaders around the globe. And what I particularly appreciated about it was that we are all in different positions, different organizations, different, stages in life. And I think getting to hear from that diversity was really helpful for me in particular, and I think for most of us on the group. And so I look forward to being an alumni of the program and seeing it grow. It was unique to be the second year and learn from the inaugural year last year, and hopefully support the program going forward. And for me, I think being able to draw on this group as our year in the Young Executive Leader Program, as we all go forward in our careers, will be tremendously helpful. So just a lot of gratitude to everyone for all their time, and to Sylvia, you, and the rest of the IHF team for all of your support and mentorship of us over the last, gosh, I don't know, 9 months or however long it's been. Thank you.
Thank you, Renee. Yeah, it was this year the time went a bit strange. You don't know if it was fast, if it was slow. Some months were faster than others. Anyone else would like to give a final remark before we move on? I see nodding heads. Okay, so I have to thank you all again so much for your information to all. This is the end of the adventure for 2020 Yale group, but they will be graduating to the Yale alumni, as was described by Renee. So for this, I'm going now to hand over to Ronald Lavater, who is the new IHF CEO. Thank you all again. We hope that you appreciate it. And Ron, I hand over to you.
Great. Thank you, Sylvia. Let me start off by just quickly introducing myself, because I've met many of the Yale participants, but there's a lot of people also on this call. So I'm Ron Lavater. I'm the new CEO for the International Hospital Federation. Eric has retired. We had a great transition over a 2-month period. So I actually started a couple months ago, but now I'm the official CEO of the organization. And as I assessed the organization and I came into the International Federation, this is absolutely one of the shining programs that we have put in place. And it's a testament to the folks that are involved, the participants in the program. So I want to thank the steering committee. I want to thank all the participants. I want to thank Sylvia from an organization standpoint. And I'm just super pleased. And I'm also pleased to share that we are entering into the next cohort, the 2021, and we're going to continue to put some more resources into this program. We believe at IHF that it is super important for us to connect healthcare leaders around the globe, to build those relationships, to learn and share amongst themselves. That creates a stronger leader within the organization. And it really is and when you look back at this year, certainly I think you'll hear this a lot in December. Wow, thank goodness 2020 is ending. At least you'll be able to look back and say, well, it's not all COVID. I also had something in my personal development that I will remember and carry with me through my career. And certainly some of the relationships and even friendships that you've created, you'll continue to carry through with you in your career. So what a great journey. Thank you for investing the time and energy, the output that you're sharing across the globe, the articles, the posts, the information. This type of webinar where you're sharing is also very valuable beyond the Yale group. So I want to thank you for doing that and thank you on behalf of the IHF broader community. So as we conclude, we're going to say thank you and congratulations. You are now joining the Young Leadership Group alumni. Sylvia has great plans for us into the new year, not only activating the participants in the program, the Yale program for 2021, but also making sure that the alumni from both of our programs are involved, are able to contribute and still stay connected. So I'm super excited about that as well. Sylvia, do you want to talk about the application process for 2021?
Sure, thank you, Ron. So the applications are now open. I have included in the chat box the links to the webpage where you can find all information. You will also receive the information later on when we send you the recording of this webinar. So also, if you have any question about this, feel free to drop us an email at the IHF. And the applications will be open from today to January 25th. The application is quite easy. You just have to download a application form. You need a recommendation letter, and we will take a group again from 15 to 20 people. So we hope to have given you some interest to this program through this webinar, and that we will have many interesting applications. And yes, we will start to work all together with the new group and the alumni, who will also remain connected and involved from March to November, where hopefully they can have this webinar as a face-to-face in-person session at the International Hospital Federation's World Hospital Congress in Barcelona. So Ron, I'll hand over to you again if there's anything you'd like to add.
Yeah, I would just like to add, we do see some light at the end of the tunnel with the vaccine being picked up. There's countries that are already vaccinating their populations. The UK started yesterday. We have a speaker from the UAE. They've been doing the vaccine for weeks already. So we have some light at the end of the tunnel. So the World Hospital Congress in November in Barcelona, we encourage you to make plans and join us there. The virtual experience has been great, and we used it to our benefit during this time of pandemic. But we also need to get together as people. And I think this is a great opportunity to continue the sharing and continue the learning and actually meet people that you've talked to for over a year in person. So mark your calendars for that. And you can find all of that information on our website. That is it for me. Sylvia, why don't you close us out and look at that almost exactly on time.
Thank you, Ron. So now I will hand over to Patricia again. I thank you again, all the Yale group. Congratulations for this great year. It has been a pleasure working with you all. And to the audience, thank you again for joining, and we hope you have enjoyed. So Patricia, I will hand over to you.
Thank you so much, Sylvia, Ron. Thank you so much. And also I would like to thank Siegfried, Vanessa, and also Safia for that very insightful presentation. And of course, congratulations to all the new Yale alumni. Before I close the session, I just have a few reminders for all our attendees. All right, so as I mentioned earlier, this webinar is being recorded, and we'll email you the link to the recording in a few days. In the meantime, you can watch recordings of our past webinars on our website. Just go to www.ihf-fih.org/webinars. And as Sylvia mentioned, you can get more information about the IHF Young Executive Leaders application for the 2021 program. Also on our website, just go to www.ihf-fih.org/young-executive-leaders. Also, on the 15th of December, we will be honoring healthcare workers around the world who have give an innovative and outstanding job in fighting this pandemic, in facing this pandemic. So we hope you can join us on social media to thank them, honor them with the hashtag thank you healthcare workers. And also on the 15th, we will also recognize 100 plus hospitals and health service providers around the world that proactively put in place outstanding innovative responses in facing COVID-19. And you can check the hashtag Beyond the Call of Duty on the 15th of December to be updated about those hospitals and health service providers. So that's all for today, everyone. Thank you again for joining us today. We hope you have a lovely morning, afternoon, or evening ahead of you. And of course, please stay safe and well. Goodbye, everyone.